Today, we're diving into a pretty revolutionary idea in medicine, one that suggests the difference between a good doctor and a great one. Well, it isn't just about knowledge from a textbook. It's about something way more fundamental, their actual state of being. So let's get into it and explore what's called the TriSync Model.
Just think about it for a second. Medicine is this world of incredibly high stakes, right? We put our lives in their hands and, we kind of expect them to be perfect. But that pressure, it totally ignores a basic truth. Doctors are just people. They get stressed, they have emotions, they get tired, just like the rest of us.
And that right there, that leads us to this huge kind of hidden challenge in medical training. What if the biggest barrier to amazing patient care isn't a lack of information, but what's going on inside the doctor's own head? How they're feeling physically and emotionally? It turns out that has a direct and pretty profound impact on their ability to think clearly.
And yeah, the neuroscience on this is crystal clear. When everything's calm, our brains can access all those high-level functions. But you introduce stress, chaos, uncertainty, that access gets restricted. Suddenly, critical things like working memory, complex judgment, the exact things you want your doctor to be using, they just go offline. Their brain literally shifts from peak performance into survival mode.
So the big question is, how do you train doctors to handle all that pressure without their brains shutting down on them? Well, this is where a really exciting new framework for medical education comes into play. It's called the TriSync Model.
So here it is. The core idea is actually pretty simple, but it's so powerful. It says that a doctor's best performance depends entirely on their state. To get to that peak clinical reasoning, their physical state, their emotional state, and their cognitive state all have to be synchronized. They have to be working together in harmony, not fighting each other. And of course, we've got to give credit where it is absolutely due. This entire framework, this whole concept, it's not just some random idea. It is built on the extensive and frankly groundbreaking research of Dr. Joseph Peter Delaney.
Okay, so this is the absolute key. This is the paradigm shift. For decades, medical school has basically treated the body, emotions, and the mind like separate subjects you have to learn. The TriSync model just flips that completely on its head. It says no, these aren't separate domains of learning. They are the interconnected conditions for learning. You can't actually master your thinking if your body and emotions are out of whack.
So what are we talking about when we say synchronized? Well, the TriSync model breaks it all down into three core pillars. These three things are the foundation of what it calls clinical readiness. First up, you've got embodied regulation. That's basically being aware of and managing your physical body. Second is effective engagement, which is all about your emotional state. And third is cognitive integration. That's the clear, high-level thinking we all want. The best way to think about it is like tuning an instrument. If one string is off, the whole thing sounds terrible. All three of these pillars have to be in tune to get that peak performance. And really, that alignment is the whole goal. When a doctor can get their body, their emotions, and their mind into a state of coherence, that's when their full potential is really unlocked. It creates the perfect conditions for not just learning, but for clinical reasoning that is sharp and, most importantly, reliable, even when things get stressful.
Now, I know what you might be thinking. This all sounds very internal, right? It's all about what's going on with the doctor. And it is. But the most powerful part of the TriSync model is how all this internal work translates directly into better care for the patient.
Just look at this chain of events. It all starts with a doctor just noticing their own state. That's step one. From there, they can actually work on synchronizing those three pillars we just talked about. And here's the magic. Once they're internally regulated, they are so much better equipped to tune in to what the patient is actually going through. That journey from self-awareness to patient awareness, that's the real path to compassionate care.
When you really step back and look at it, the implications of this model are just huge. If we start adopting a TriSync approach, it could reshape not just how we train individual doctors, but the entire culture of healthcare itself.
Because think about it, when doctors are trained to be more self-aware and regulated, it creates this incredible ripple effect. You get better communication, you get stronger teamwork, you get learning environments that are supportive instead of just stressful, and the ultimate outcome of all that? It's safer, it's better, and it's more deeply compassionate care for every single patient. So, we'll just leave you with this final thought. In our world of amazing medical technology, it's so easy to forget about the human at the center of it all. But what if the next great leap forward in medicine isn't some new machine, but a deeper understanding of the person wearing the white coat? What if the real key to healing other people actually begins with understanding ourselves?